CCTV
Hatu pindon am kathong man long kita kinong shed hagi hotel and hagi restaurant iba pau hamokam hilaban pun long e kathong ko jongpi ke admission club play bani ai ki course ki bope kadon ka degree course ka diploma ba ka advanced diploma course.
Menteri Kesarkar Pedang Bakmi ke Ministry of Health and Family Welfare UJP Nadda haka sautarik ujalio arja apan rio ula Plie Paidbah ya ka Arhi Hospital kawai nak unit jang Far East Wellness Private Limited haka senang Jarabat Riboy District kani ka hospital kandairu kawai nak Islam ajing sumar ka ban ajing Pynmyntoi ya ka jala Meghalaya bagi jala ka than stay lammi ngi haka ni ka jingalang la sakilang ru menteri ka kot ka khia sarkar jala ba wailat bagi shala Menteri Sarkar ba Sasanes Sotun u MLA ba ALHEC bader chairman jak Arhi Hospital bat kiwei.
With the vision of transforming healthcare delivery in the Northeast. Arhi, a Sanskrit word which means a model or a prototype. We dream to build a healthcare model that combines world-class medical expertise, advanced technology, compassionate care, and affordability under one roof. With this dream in mind, we were fortunate to meet the then Health Minister of Meghalaya, Dr. A.L. Hexer, who had motivated us and helped us in all the possible ways, so we are here today. At Arhi Hospital, we are guided by a simple yet powerful mission to deliver advanced healthcare services with compassion, innovation, and excellence. We believe that every patient deserves access to quality healthcare, medical regardless of their background, and we are committed to making that vision a reality. Spread across a sprawling campus at the entrance of Guwahati, Arhi Hospital has been thoughtfully designed to provide comprehensive healthcare services in a healing environment. With over 120 beds, more than 25 ICU beds, 6 modern operation theatres, dedicated daycare facilities, and extensive support services, we were equipped to manage everything from routine healthcare needs to the most complex medical and surgical cases.
So with this hospital coming up in this beautiful location, I feel that it will really bless our people of the state. And no doubt there are so much have been coming up, especially under the leadership of our Chief Minister. Just to inform our Union Minister, sir, that I think out of all the state in India, sir, we spend 8% of our annual budget for health, sir, in Meghalaya. So this shows our the seriousness and our concern, and we really want to help and to give the affordable and accessible healthcare to our people, where average government spending, the average government spending in India, if you take, it is below 3,000 per person. But in Meghalaya, it is more than 7,000 per person, the government spending. So this shows that we are really looking forward, we like to really want to provide the best healthcare for our people, but there are different set of challenges. And just to inform our Union Health Minister that few years ago that Meghalaya is above the national average in the model mortality rate and the infant mortality rate. But due to the initiative of our Honorable Chief Minister, starting the Chief Minister Safe Motherhood Scheme, that I'm so proudly stand here today that now it is below the national average. And we will continue to work hard to see that that number will come to zero.
It's a very significant milestone, a huge initiative which has been taken in health delivery in Meghalaya. At the outset, when I congratulate, I also really admire the vision which you have kept, because in a hilly state like Meghalaya, thinking of a super specialty, that too in the private field, is no less than a dream. It's no less than a dream. And making dream reality is really commendable. So first of all, at the outset, I congratulate for your vision, dedication and the hard work through which this institution has come up. It has got the most modern facility, which I am told, and it's not only the mere creation of the building, but the creation of the hope and the security and the quality which you are providing through this Arhi hospital, that I would like to certainly enunciate to you. As you all know that under the dynamic leadership of Prime Minister Modi, the growth story in the health sector has been, and it's not only the health sector. My friend Wailad narrated just now that in only a short span of 1 month, if 5 ministers are coming and they are having a meeting in Meghalaya, you can understand how much emphasis is being given and how much mainstreaming has been done as far as the Northeast is concerned, and the thought process when he said that look east, when he said act east. So it's not only in words, but it is in deeds that we have to understand. So under his leadership, really the region has witnessed a rapid development in healthcare also. And I'm happy that this institution which is coming up, it is private in center certainly, but it is with a full-fledged oncology unit. I'm also told that PET CT scan is the only CT scan here in Arhi hospital in Meghalaya. So that is very commendable. And advanced diagnostic facilities are there, critical cares are there, as MP Singh ji told that there are 6 modular operation theatres are there. So building of the healthcare in the last few years has been very rapid, and if I say so, in the last 12 years that we have to understand. A lot of emphasis has been given to primary healthcare, tertiary healthcare, secondary healthcare, and I would also like to share with you that the thought process, how it changes and how the scenario changes. In 2014, when we took over and Prime Minister Modi as the leader, our dynamic leader, took over the reins of the country, he asked us to relook of the health policy. And I would like to share with you that before 2017, we had a health policy which took care only about the curative part. That means, पहले बीमार पड़ो और बाद में इलाज करो, और इलाज करने का जिम्मा हमारा, बीमार पड़ने का जिम्मा आपका. It was in 2017 that we made a policy which was comprehensive, which was inclusive, and it was preventive, it was promotive, it was curative also. It also took care of the palliative part. It also took care of the geriatric part. So a comprehensive health policy came in 2017. And because of that, for the first time, the primary health care was given importance. And I would like to share with you that we have now, which you used to call at that point of time, sub-centers, primary sub-centers. Now these sub-centers, these primary health centers, PHCs, and to some amount of CHCs, all these have been converted into health and wellness centers, which we call as Ayushman Arogya Mandir. And now they are 1,81,000 in the country. And this 1,81,000 is the first contact point between 1.4 billion people. It is the first contact point where we are trying to connect with the 1.4 billion people. And as I said that it is a preventive part. We have 50,000 out of these 1,80,000 NQAS, National Quality Assurance Standards. That means they fulfill the national quality, the qualitative part and that assurance and the standards have been maintained. But we are trying to see to it that 1,80,000, all of them become NQAS, National Quality Assurance Standards, that is maintained. But what do? We ask the ASHA workers, we ask the Panchayat Pradhans, the primary PRI's representatives, to ensure that in their area, anybody above 30 should be brought into this Ayushman Arogya Mandir, that is the health and the wellness center.
Arhi Hospital was established with a clear mission to provide a world-class healthcare services at affordable cost and to ensure that the people of Meghalaya and the Northeast have access to advanced medical care closer to home. For too many long and many families have had to travel great distances for specialized treatment. Today we take a significant step towards changing the reality. On this special day, I would like to express my sincere appreciation to our boards of directors, our medical and administrative teams, our partners, consultants, staff, contractors, and every individual whose hard work and dedication have made this dream a reality. This achievement belongs to all of us. As we inaugurate Arhi Hospital today, we do so with humility and responsibility and a firm commitment to save humanity. We pledge to continuously strive for excellence, uphold the highest ethical standards, and work tirelessly for the health and the well-being of our community.
Mornings are always busy. Everything feels fast. I hear mom shouting and I'm trying not to be late. Outside, Shillong is already awake. Cars move slowly, horns are loud. It feels like everyone is in a hurry. Then the STEMS bus comes in, bright and yellow, always on time. The caretaker waves and I feel okay. Inside, we laugh and sing. We share snacks, we help each other with homework. It feels nice. My parents know I'm safe through the STEMS app on Mom's phone. Because this bus isn't just a ride. It takes us to school with friends and a little bit of hope. This is STEMS, our ride, our future.